My name is Michael Rubino. I'm on a personal mission to make sure you don't get sick inside your own home.
I knew there was something wrong. I'm just so relieved there's something that you can do about it.
Hello, and thank you for taking the time to visit us at another episode of Never Been Sicker. I'm your host, Michael Rubino, and today's amazing guest is Mike McIntyre. Mike, it's been great to get to know you briefly so far, and really looking forward to having you on this podcast. Please explain, a little bit about who you are, the journey that you've been on, and where that led you into the amazing technology that you've developed.
Yeah, thanks, Mike. Thanks for the intro, and thank you for what you do. I mean, I really appreciate mold is yuck.
Oh yeah,
that's a technical term for it, but so I actually, in terms of light therapy and photobiomodulation, I got back into this almost 20 years ago, and we were supplying estheticians with facial panels. So these were, multi-wavelength panels. So we got to see, 20 years ago, what happened with the blues and the ambers and the reds and the, et cetera, et cetera. And it was kind of the Wild West back then. So we figured a lot out, obviously, over 20 years of work. But, we saw a lot of things fall out. We saw a lot of things actually prove out. But the thing that got me into it, and really what created this full body light bed, this energy medicine chamber that we've created, is hearing from estheticians. They would put these light panels on somebody's, diabetic ulcer or back pain, or they blow out their knee, and I'd get a call every week. It's like, do you know what this thing is doing now? So I kept hearing this, and then I started at about 2012. I started piecing together panels and going, okay, what if we put a panel and we create a full body light bed, and then 2015, we actually, it took a while, but finally came out with our first light bed. We created a company called ARRC LED as well as ARRC Biotech. And with an emphasis to move away from what traditional red light therapy was. Because back 20 years ago, we were putting green on the face, and green creates endorphins. We didn't know that until about 2022. So when you use green, you just felt better. Something happened with that. We found out, for example, the blues would be, can damage the retina. So we didn't want to take a chance with that. Green is antiviral, antibacterial. The reason that you'd want to use blue is because of that. So basically, we created a full body light bed. We expanded upon traditional red infrared wavelengths. So traditional red infrared is absorbed into a chromophore. It's actually an enzyme inside the mitochondria, which is the energy producing center of the cell. We expanded that from one chromophore, the cytochromacy oxidase, up to 3 chromophores. So now we have 3 different benefit curves on our light device. Then we took those 6 wavelengths of light and we said, okay, what happens if we are able to pulse that we pulse our devices up to 400,000 hertz. And the reason we do that is because with frequency, we can create a device that is very targeted to attack pathogens in the body. Okay, so obviously different types of mold or different types of pathogens. So we can target that with our light bed. And then we also, in the light bed, we send information patterns into the body. And what those information patterns are, essentially what we're doing is we're sending a blueprint into the quantum field with the idea that, for example, we send a blueprint for a healthy liver, that the body will then up level to what that healthy liver looks like. So we send that blueprint in the quantum field, and then the body is basically, our intention is for it to entrain to that. And there's some pretty cool research on that right now coming out of USD, UCSD, and things like that. So that was the impetus to create ARRC LED, ARRC Biotech. And yeah, we've been having fun with it. So up to about this point.
Well, I mean, it sounds like a lot of fun, and I'm sure you're helping a lot of people in the process as you're developing, these amazing technologies. And so, I want to dive into the science a little bit, just between, the different light therapies that you've touched on earlier. First off, just to make things super simple, the color is actually something we perceive, but behind the color, there's actually the wavelength, right? And the wavelength, we're talking about actual frequencies and using different frequencies to heal the body depending on what might be wrong with the body. And is that correct?
That's correct. Yeah. So basically, if we look at a wavelength of light, we're talking about, if you've got a wave, it's this distance between the top and the bottom. And that's actually a measurable distance. It's measured in nanometers. Nanometers are 10 to the minus ninth meters. So you have like a 633, which is kind of an orangish red. You go a little bit longer, 660 is ruby red. And then you go into the infrareds, which you really can't see. Greens are in the 500s, blues are in the 400s. Yeah. So that's the wavelength. Then what we can do is we can take those wavelengths of light and we can shape them. We shape them by pulsing them, turning them on and off X amount of times per second. Okay. So by doing that now we can, literally vibrate cells to death. And I'm not saying us in particular, but the research is out there, and actually there's companies with phase 3 approval with the FDA to use what we call resonant frequency. And resonant frequency is, you probably don't remember this. I'm old, so I remember, but I remember the old commercials when Ella Fitzgerald would sing, and the frequency of her voice would create an uncontrollable vibration in a wine glass, and that wine glass would shatter. Okay. So this is now, Royal Rife did this back in the 1920s, and he was successful at targeting pathogens in the body. And basically what happens is he would create a frequency. That frequency is very specific. And what it would do is it would hit the liquid crystals in the cells, and that would vibrate those to death. So what's happening now with resonant frequency, and this is to me, this is the future of medicine. When regulatory and research allows us to actually do this, it's going to be a different world. But basically, what they found in research is that cancer, for example, has resonant frequencies between 100,000 hertz and 300,000 hertz. And in the research, what they're showing is that they can destroy 25 to 42% of, for example, leukemia cells, and they do that within 3 minutes. So basically what you're doing is you're sending this pulsing pattern into the body. Okay, so the wavelength of light is the color. So reddish orange, 633 nanometers. And then we pulse that X amount of times per second. And what the research is showing is that if you can pulse that, say, 160, in fact, the kill zone for leukemia is like between 158,000, 162,000 hertz. So if they pulse it at that, they can destroy 25 to 42% of the leukemia cells in the body. So that's where research is going. It's the energies that we carry into the body, and that could be a pulse electromagnetic field. We use that in our systems. Can be light, could be scalar information field, could be TENS. So we use different carrier energies. So we carry these different frequencies into the body with the intention that the frequencies or the information patterns will then add on to what the carrier energies do. So I'm sorry, I'm rambling here. Cut me off
Not at all. No, but it's actually really interesting too, because for those listening that might not know a whole lot about frequencies, but there are actual medical devices that can measure frequencies produced by certain parts of the body, especially those parts that are in pain, right? And I mean, I've seen it live, where somebody has a pain in their chest, and this machine, basically, it almost looks like a little metal wand that they're putting around the body, and as you get closer to the pain spot, the machine starts beeping, right? And so what it's showing you is that obviously there are frequencies that are, created within the body, which would make sense why certain frequencies could be used to potentially heal the body, right? For various things. So I think it's, for those listening who might not have never heard of such a thing, I mean, it's already, pretty well known in the medical community. The other thing that's really interesting too is I've seen some studies come out. We had a guest on the podcast before, Mario from Analima, who's a water company, and he actually basically uses frequencies to create structured water. And it's really interesting because a lot of the studies that he's done have shown, that plants are growing, plants that were dying on their way out were able to bounce back, 42% more rapidly or whatever those specific statistics were. But you can clearly see that using frequencies, there's a massive benefit. So it's great that you're kind of, really leading the charge here.
Yeah, and it's kind of fun. So we have frequencies and we have information patterns. And basically, so we can use frequencies to either destroy crystalline structures in the body, through vibration, or we can use frequency to strengthen energy centers in the body. So it can be used to destroy or add to. And then also we can use information patterns that we send into the body. So basically what happens is you mentioned that with structuring water. So we actually license this technology. We put it in our light bed, where what they will do is they will imprint water with an information pattern. And then that person drinks that, and basically that becomes, the remedy or the cocktail to help them. We've taken that technology and now we send it into the body on the light. That's our quantum imprinting codes that we talk about. Basically what we're doing is we're imprinting the quantum field with a blueprint so that the body can entrain to that. So yeah, it's fun. To me, the future medicine is going to depend on the carrier energies that we use, how we sequence those carrier energies. Do we use pulse electromagnetic field first, followed up by light therapy, followed up by a scalar field, or do we do them simultaneously? And then, how do we shape those energies? Okay, we shape them with frequency, turning them on and off per second, or use those wavelengths of light to send information patterns into the body. So how we stack, shape, and sequence energies, I think, is going to be the future medicine. And yeah, it's fun. We're doing it now. There's a lot to learn.
Oh, I'm sure.
We got the capabilities in the light beds to be able to do it, but we're waiting on, research to really catch up. And so as the research catches up and it says, here, do this, right? Take these wavelengths, add PMF, stack them in a certain way, hit them with different frequencies, and then basically record those outcomes. We're doing clinicals right now, clinical trials on this, so we can figure this out. But hopefully 2 to 5 years from now, we'll be able to really figure out how to use our light beds, right? We built these capabilities into it. And then we've got to get regulatory going. So obviously got to be able to do it. But this is the future medicine, I believe.
Yeah, I don't doubt it. I mean, using frequencies. I mean, we already hear a lot about light therapy. We already hear a lot about sound therapy, all of which trace back to frequencies and all the amazing things that come out of that. Obviously, from a medical perspective, right? A lot of our medicine comes from the pharmaceutical industry, and it's a lot of, hey, if you've got this issue, here's this particular drug that could help with that. But as we've really have learned over the past couple of decades, the air we breathe, really important to human health. There's no pill for that, right? The food we eat, really important for human health. Again, no pill for that. You got to eat good quality food. You got to drink good quality water, right? No pill for that. And we have the other thing that I think people miss a lot is frequencies. I mean, you are constantly being bombarded by frequencies. I got these lights staring me in the face right now to light up my face so everybody could see me here as I'm on this podcast. But that's frequencies, right? It's doing a great job. Well, thank you. That's frequencies, right? That are coming in and obviously, coming into contact with the body. And so, it's no secret we are being bombarded by frequencies all day. I mean, if I turn my microwave on, I might not see the frequencies, but there's frequencies coming out, right? And so I think it's a lot of people, I think, tend to forget about things that they're not able to see. things like mold that's really small, things like frequencies that are really small. And so it becomes this elusive subject. But really, I mean, it makes a whole lot of sense to me. Frequencies are everywhere. Being able to manipulate frequencies or create frequencies to create different effects, I think that's kind of a no-brainer here. And it's one of those things where I think once you realize that, a light bulb turns on. Before that, you don't understand it. It's a little mysterious, but I think once you really connect those dots, it's pretty brilliant. Now, in terms of you've been obviously doing this for 20 years, right? And so this is probably this amazing thing you've stumbled upon. And obviously you've kind of been working with it for 20 years. As you mentioned, there's still a lot you don't know, right? But you're a visionary. As you take a step back and really look at this objectively, maybe there's a couple different paths that this thing takes, but where do you see, we said this is the future of medicine. What capabilities do you believe we're going to achieve through this, the power of frequency?
Remember the movie with Matt Damon, Elysium? And for those people that might have watched that movie, essentially this little girl, I believe she had leukemia, and the mission was to, the movie is set in the year 2154. So the earth is dying. There's not a lot of resources, certainly not healthcare on the earth. And above it is this bubble. In this bubble, they have this energy medicine chamber. Anyway, Matt Damon's job is to get this sick little girl up into the bubble where the wealthy people live so that he could put her in this energy medicine chamber and fix her sick person in, healthy person out. So we set a mission statement. Our mission statement is sick person in, healthy person out. And while we see things like, eczema, for example, we've got before and afters of people where, this woman's legs are just scabbed up. 6 weeks later, she's off medication. All right. We did not treat the eczema. We changed the underlying bioenergetics. She got healthier. All right. So the question is how do we take that 6 week time period and turn it into 5 weeks or 4 weeks or 3 weeks? How do we get the sick person in, healthy person out? We're called kind of the Star Trek of the industry. And if you remember Star Trek with Bones, he would take this little scanner, he'd scan somebody and they get up and walk away. They're better. That's the vision. That's the vision. It's awesome. A moonshot, but yeah, I think as we learn more, we're going to get closer to that point. So, I want to say this. What you're doing is absolutely the precursor. We're taking people who are already sick. You're preventing them, right?
That's true. But as I look at this, we said it's a moonshot, right? And the reason it's a moonshot is because it's almost inconceivable at this time, right? We don't have anything close that closely resembles this possibility at this point. However, you look at Star Trek, right? Obviously that's mirrored in the future. You look at this movie, that's mirrored in the future. We don't know what 2050 is going to look like. I mean, the technology advances so rapidly today. Yeah. It advances far more rapidly than it did 10 years ago. I mean, the technological advances are exponential. Yeah. Right. Okay. And so the reason why it seems like a moonshot now is because it's inconceivable of the technology that it would require, or the studies of the exact, essentially combination of different frequencies or what have you that it would take. But I think this is definitely something that's going to happen, right? I think just like we're going to learn a lot more about food, right? I mean, we've got everybody's up in arms right now about Kellogg's and food dyes and our food supply and how all that stuff is. That's great. It's awesome. Right. But we still don't know a whole lot about food. And we're still trying to get our diets wrapped around, right? We're still trying to learn a lot about exercise and how much exercise do we need and how much exercise is too much exercise. And, I think as the technology advances, right, and we begin to learn more and more about all these different things about the human body, I mean, we're going to live longer. I don't think 100 years is our actual maximum lifetime. I think 120 is what they think that the average lifespan will be at some point in the future, which is really interesting to see. I think there's so much we could learn.
Mm-hmm.
And if your device, if your device becomes a reality where it's sick person in, healthy person out, I mean, I can't imagine how much longer and healthier and happier lives we could have, right? And so keep fighting for that vision because it's so needed. And yeah, I mean, I'm doing the best I can with regards to educating people about the crap that they breathe in on a consistent basis and preventing that. But the reality of it is, I see a lot of sick people too, and we've got a long way to go to being able to prevent illness. And so right now, when people really are sick, they need answers, they need help, and they need solutions to getting better. And so anything and everything that exists at this current time is helpful. And so I'd love for you to share some of the success stories you've had, maybe some client testimonials using your equipment today, right? And I know we're not looking to make any sort of health claims at this time, but I would love to just hear some anecdotal stories about some miraculous health changes that people are having that you're hoping to continue to study upon so that one day you can make these health claims.
Yeah, we had, and this was actually 2015 with our first light bed, which is nowhere near the complexity or the power that we have today. But first testimonial, 82-year-old guy in a wheelchair on oxygen, and his blood sugars were up in the 300s. And, and understand this was the Wild West of a full body light bed. We were coming out, another company came out the same time we did. And anyway, within 2 sessions or 1 week, his blood sugars were down to 129. Understand this is when we're starting all this out with a full body light bed, and the doctor's monitoring him. So we're monitoring closely. So anyway, 129, and then he was at 107. Within 2 weeks, he had changed his medication. We see that on a regular basis. And in fact, we're doing clinical trials right now with a major hospital group on A1C levels to see what can happen with that. All right. And, for example, we use green light in our system. Green is absorbed in the hemoglobin, the oxyhemoglobin. So basically, we're supercharging the blood. And we believe that's partially why we're so effective with that. We've had 2, and understand, I'm going to mention cancer. We do not treat cancer. Cancer is actually, I've called it a contraindication for the last 7 years because we just don't want to mess with it. But I've had people actually use our machine. In the last 9 months, we've had 2 stage 4 lung cancers. In fact, it was the lady told me the story about her husband. He was in the medical office. He had stage 4 lung cancer. The doctor looked at the scan, and he's like, something's wrong. So he scanned him again. He's like, something's wrong. Scanned him a third time, and doctor turned around. He had tears in his eyes. He said, I don't know what happened. The nodules are all gone. So that's cool. That's cool. We see that stuff, and again, we're not treating a specific condition. We're changing the bioenergetics underneath the cells. That changes the cell. If the cell gets healthier, then the tissues, organs, and systems are going to get healthier. And they're better able to respond to, whatever it is, the toxins in their body. Like what you're doing, you're cleaning out the toxins in the environment. All right. We're coming in kind of after the fact and cleaning out the toxins in the body. Also, and it's not just about making a sick person better. We're in the majority of the NFL, every branch of the military. And the reason for that is the performance enhancement that happens with photobiomodulation. So I had one of our owners came in and he said, Mike, I just did a triple at my all-time best on the squat. And if you're a weightlifter, you understand that doesn't happen normally. He goes, I wasn't even training. I did light bed first. All right. So we see people getting their personal best without really even training, just from energizing their cells, energizing their body. Photobiomodulation increases single rep max, total reps prior to failure, total reps in a given time period. It protects the athlete against damage that happens during competition. So basically your body's getting better, your body's getting stronger. So it's not just about disease, it's also about performance. It's also about, from an aesthetic standpoint, peer-reviewed published research shows that it will increase collagen production by 138 to 211%, and it tightens up the elastin layer. If we can thicken and tighten skin, we can get rid of wrinkles, right? From a weight loss standpoint, if we use specific frequencies, if we send into the body red infrared light, basically what it does is it opens up, creates pores in the fat cells, and then we can exit that fat from the cells. So basically, as part of a protocol, it doesn't do it on its own, but as part of a protocol, you can use it for weight loss. All right. We can now take that and we can take what the light is doing and shape that light with frequency so that we increase metabolism in the body. So now that person's actually better able to burn fat. So, from a weight loss, that our trademark is feel, think, look, and perform better, because there's so many things that this does. And again, it goes down to the root. And basically that root is we change the bioenergetics underneath the cell. The cell gets healthier. That cascades into tissues, organs, systems. Nearly everything benefits on it. So it's long explanation, but there's a lot going on. We've seen a lot. It's really cool.
No, that's really incredible. It's really cool. I mean, you guys are in sports facilities. You guys are in the military. I mean, it's awesome. You're not just working with sick people, but you're actually also helping people just get to peak performance, which I think is really awesome. And this way, as when you said, a sick person in, healthy person out, as people get healthy, they still will want to use it, right? Because it obviously not only gets them healthy, but now it takes them over into that performance realm of getting better performance. And so
I'm gonna hit on something too. I'm sorry to interrupt you, but what you hit on longevity and 120 years old. One of the things that we do in our light bed is we target the water in the cell membrane with the intention of basically structuring it or charging it. And if we can structure it or charge it with frequency, then we can increase a biomarker called phase angle. Phase angle is a biomarker for longevity. If you have a higher phase angle, you're going to live longer. You're going to live with less fragility. You're going to create a barrier against cancer, diabetes, arthritis. What we're seeing in our testing is that we're increasing phase angle for every client after every session. And then we're also looking at this on a 90-day trend line where we're seeing it trend up. That's one of the things that we also want to, from a research standpoint, we want to get with and run a clinical trial on that. That's what we're working on as we speak, is to actually prove that out. You might have remembered a couple of years ago out of Israel, they did the hyperbaric oxygen, and they showed that it actually increased telomere length. If it increases telomere length, we live longer. And that was a big buzz around the community. I believe we're going to see the same thing with light therapy. We just need to do the research on that. Sorry to interrupt you.
No, that's incredible. Thank you for interrupting me for that.
Right.
Speaking about, I mean, I don't think you even mentioned your company's name yet. What is the name of your company?
It's our company is ARRC LED, Apple Red Cherry. It's Advanced Rejuvenation Recovery Chambers. We did this, and then also have ARRC Biotech. And ARRC Biotech is basically a supplement. This is going to be fun. It's a light supplement that we are creating, where you literally can listen to a soundtrack and receive from a quantum field this supplement remotely. Anyway,
that's incredible.
So,
well, I'm looking forward to seeing that come to fruition as well, to give that a whirl. I want you to explain a little bit. You have different beds, right? You have different devices. Would love for you to explain a little bit about them, some of the differences. And of course, we need to touch on where people can get them.
Right. So, first of all, we are a U.S. manufacturer. We build our machines here in California. We build all of our electronics here in California. The LEDs we use in our system are out of Germany. And so we're the supplier of the devices. We don't bring them in from Asia or anything. And I apologize again. Part of that question was
Oh, sorry. Yeah. Well, so I wanted you to explain a little bit about the different technologies or the different beds that you
different
have,
different beds.
and how can people get access to them, right?
Right,
Obviously, they're not the cheapest product in the world, right? So
right,
some people may not be able to afford having them in their own home. Others might be able to,
right.
but for those that are looking for doctors that have this technology in their facilities, how might they find where to access, where to find that access?
Right. So we have several different beds. We've got what we call the ATP RFQ. ATP was a lighting system that we developed in 2018. RFQ is resonant frequency quantum. So from 2018 to 2021, we did 20 different prototypes to get to this 400,000 hertz. That's the ATP RFQ. And then we're also introducing a device called the Elysium device. The Elysium device is that we think that's going to give us the ability to get the sick person in, healthy person out. So as AI comes in and it figures out which frequency combinations, how we shape and sequence those energies. And I think, we talked about the movie Elysium and 2154 and future. You're absolutely right. What you were alluding to is it's going to happen a lot faster, right? I think we're going to learn how to use this with AI probably in the next 2 to 5 years. So I think that's where we're going to go. In terms of where people can get this, we have a locator on our website, arrcled.com. So you can look at that locator. We're in a number of different chains, a number of different facilities. Doctor's office has it. And then we are also in the position where we'll be launching our own centers. It's called the charging station. We'll be launching our own centers, and that actually go into medical offices. So that starts actually in January. And our goal is really just get as many of these out there as we can, get them working, get people in so they can use it. And yeah, you're absolutely right. These are expensive devices. What we want to be able to do. And that was always our mission. Our mission was, how do we make this affordable so that everybody can do it? Not just the 1% or the 1/10 of 1%. That's really, we want to make this available to everybody. So
And of
thanks
course,
for
that happens with time.
Mhm.
As more technology advances, things become cheaper as you can mass produce them, and so it will over time. But look, for people to be able to go to their doctor and have access to this device, that's amazing. And for people that have maybe that have multiple devices in their house already, in terms of just health and wellness and saunas and this and that, maybe they want to take the plunge and have the investment and have this device in their house. So that is a possibility for folks as well.
We're trying, and also that's a great segue. So we're building a device. It's what we would call a mini Elysium, and actually this will be out in January, and it will be a combination of pulse electromagnetic field therapy, light therapy, as well as scanning technology. So it will scan you and then create augmentation profile for you based on what it sees for you, and then basically you get into the bed. We call it HD home device. I mean, it's a pretty simple name. And it's priced so that we can get in, we can help a lot more people out. So, yeah, we're excited about that.
Well, I'm excited about it too. It looks like it'll be a late holiday gift for me, coming out in January.
Very cool. Very cool.
Mike, I want to really thank you so much for taking the time today to be here and talk about everything that you're doing. I like I said, I had a chance to meet you offline, and was really excited about having you on to kind of share your story. Love what you're doing. I love the vision. Obviously, I have a very, very adjacent vision to you in the air quality side, and so
Mm-hmm.
it's been so great to be connected with you. And if those listening right now, please check out Mike and everything he's trying to accomplish using frequency and his technology, because I'm telling you, it is definitely going to be the future.
Hey, thank you for everything that you do. Really appreciate that, because the first step, we got to clean up the toxins that we're ingesting. So really appreciate what you're doing.